The Maxillofacial Restoration Program is a single comprehensive program that is comprised of 9 integrated clinical care pathways: dental and maxillofacial prosthodontics, patient well-being and mental health. We have our oral head and neck cancer team, functional restoration pathways, dental restoration pathway, research, education, and training, pain management and anesthesia team, speech language pathology, and our nursing colleagues. Somebody can come in with an oral cancer, a benign tumor, facial trauma, a congenital anomaly, some type of pathology or change to the upper jaw or lower jaw. Traditionally, that would entail the upper or lower jaw being removed, and then possibly a transplant from the leg bone or another source to rebuild the upper or lower jaw.
This procedure would not have been all done in one day. They might have part of the surgery done today and then might not get teeth for 18 months to 2 years later.
Really, the big difference between jaw in a day and traditional reconstruction in the US and globally is that you get your dental rehabilitation immediately. So the bone, the teeth, and your function, so your speech and swallowing, all come back that same day. So it takes 2 years of treatment into 1 day. Reconstructive success is finite. I did a procedure, I got a good outcome, patient okay, moving on. You can see how it creates silos. But if your outcome is longitudinal in process, and it is as audacious as restoring the overall health of a patient, rather than myopic of one procedure, that is how we restore form, function, and purpose.
It's more than just plugging a hole or closing a wound. We really do need to restore all these very complex functions. So it's more than removing the cancer and telling them that they're cancer-free. The goal is to be able to tell them they're cancer-free and that they're gonna be able to eat, or that they're not gonna drool the rest of their life, or that they can speak to their loved one.
The focus is not the procedure. The focus is the patient. That's the difference between reconstruction, a single finite outcome, and restoration, which is a comprehensive restoration of one's health, especially for our warfighters, so they can get back in the fight. During my time at Walter Reed, from 2011 to 2017, head and neck injuries, facial injuries were the second most common injury in Iraq and Afghanistan. But if you look back on it, we don't have any centers of excellence. We don't have any type of registries or research developed around that. If you look at the current landscape with drone warfare, the new term is top-down trauma. As we move forward to this new generation of warfare, head and neck injuries are only going to become more prevalent. And with some reports I've seen, it's over 50% of casualties are actually facial or head and neck trauma. So the next time we're in major conflict and there's head and neck injuries, we need a center of excellence, which will then give the confidence to our warfighters, and more importantly, their family, that they can go in harm's way. And if they have a head and neck injury or a facial injury, they know that we are standing by in San Diego at the Center of Excellence to restore their form, function, and purpose. So the origins of the program, it was just a bunch of people that knew that we could take care of patients better. We have built this platform with the same individuals who started 6 years ago. And so I think what has sustained us is our absolute focus on readiness and patient outcomes. Because what our team is doing is beyond the standard of care, even within the civilian healthcare system. The support from our leadership over the past 6 years has facilitated that. There is a culture at Balboa of getting to yes. There is a culture of why not. One thing that our program has that very few others do in the world is we will take risk. Having somebody stand up and walk without a walker 1 day after surgery. Having somebody take a sip of water 2 days after surgery, after having their face completely transplanted. Having this accelerated track, people getting their final teeth at 4 months. The reason we can do that is because we have the communication and the integration, which is unique to the US military.
Something like this, where an Army surgeon, a Navy surgeon are able to work together across the services, that's all part of the Defense Health Agency. And I think that's good for us surgeons and doctors to be able to take care of patients.
So a lot of the innovation and the technology and the advances that we've had here at Navy Medical Center San Diego that now has been scaled into the civilian sector, what has allowed that is the talent of our team.
Teamwork is really important in complex reconstruction in general. I think that there's good data showing now that teamed approaches for these complex cases improves patient outcomes, it improves surgeon well-being, it decreases burnout, etc. One of the advantages of working in the military system is that we have a system that encourages and allows collaboration in a way that's easier than in the civilian world.
They're awesome working with us as nurses as well. They want to hear our input, which is important, I think, from like a nursing standpoint. They want to hear what we see. They trust us in that way, that we see the patient more than anybody. So like we know any kind of deviation from baseline, if he's meeting milestones. So it's a very, very collaborative work environment with OMFS for sure.
What I've seen here is multidisciplinary approach to the patient care, where it's not just the nurse and the physician, it's the nurse, the physician, the nutritionist, the physical therapy, the occupational therapy.
Plastic surgery, ENT, ear, nose, and throat, otolaryngology, as well as oral maxillofacial surgery team.
It's the scrub techs, it's the circulators, it's the physical therapists, it's the nursing team. I think everybody just has this unified vision, and it's all patient-centered, and that's what makes it work so well.
Everyone's collaborative because we all have just the same mission. We're coming to work, we do the same thing, work together, and I think that's rare for a lot of institutions.
For every patient who comes to Balboa to be taken care of within this program, they see at least 125 individuals who directly care for them. So I think that is why we have been able to innovate at such a rapid pace. People can talk about patient-centered care, but to actually execute it, that is a culture that we work tirelessly to maintain here at Balboa.